Regenerative medicine is the process of creating living, functional tissues to repair or replace tissue or organ function.
That sounds pretty cool. Dr. Forrest Lanchberry is here to talk about treatment options that are right for you when it comes to this regenerative medicine. So this is a new term for me. What is it exactly?
Well, regenerative medicine actually it's a branch of medicine that encompasses a fairly broad area, but it includes any type of therapy that would regenerate, renew, restore cells, tissues, or organs. So it's used in all different areas in the body, or can be used to do that.
So how long have you been practicing this type of medicine?
About 6 years. So I originally had my training in Florida with the Aesthetic Aging Institute, Dr. Sharon McQuillan, and so after I had my training, I went back to Bowman, North Dakota, where I originally was practicing. And I convinced the hospital board to get me the equipment to start doing stem cells. So we actually did the first stem cells, as far as I know, clinical treatments in Bowman, North Dakota, at Southwest Healthcare.
So give me an example, like some of your typical clients. Who comes and sees you?
Mostly it's patients that have pain, okay?
Oh.
So that's, when you talk about like musculoskeletal pain, arthritis, shoulder pain, a lot of different joint type pains that are due to either tendon tears or arthritis, or sometimes post-surgical patients will be one of my common patients. There's other patients, some with autoimmune diseases and that type of thing that I see too.
So where do the stem cells come from then?
So the stem cells can come from a lot of different places, but the most common place that we get them from people, from your own body, is from your fat. So the fat has a very rich supply of stem cells, and in fact, the richest supply is where many of us have the most fat, and that's right here. So that's where we get the best stem cells. You can get stem cells inside the leg too if you need to, but the fat is a good place, and you get good stem cells. The bone marrow is another place, and bone marrow actually has a really good supply, but it's not as good as you get older. So it's a little not quite as good as the fat.
Define or explain stem cell. I think we hear that term thrown around a lot, but it just sort of never really gets explained.
Yeah, stem cell is basically a cell that can proliferate and regenerate and make more of itself. Okay, so we have stem cells everywhere in our body. Like we said, the fat and the bone marrow, but they're like in your nose. They're in the olfactory nerves. So they regenerate, they resupply, they make new cells. And you have them in your brain too, and in your eyes. So what happens as we age is these stem cells become less and less. And so actually by the time, you're really, they've done studies where a lady was 120 years old and they did a complete, tried to get every stem cell they could, and they could only find one stem cell when she died.
Wow.
So that, as we, it has a lot to do with aging that, we begin to lose these stem cells. So by restoring the stem cells, it's an anti-aging therapy too.
So how do we create more of it?
I was just going to ask.
Are you going to suggest I eat more donuts and get more gut fat?
Yeah, well, no, that probably doesn't work. In fact, that's probably contrary to actually making more. But so the main thing, like lifestyle, of course. We all know the lifestyle things that lead to longevity. So number one is, don't do things that are going to damage them, like smoking, drinking too much alcohol. Not getting enough sleep cannot be good either. Eating the wrong kind of things, too much sugar, too much, wheat even, or anything that gets turned into sugar. So you really need to keep your weight down, exercise. Exercise mobilizes more stem cells. There's certain supplements like blueberry extracts, help stem cells, green tea extract. There's some seaweed type things that actually increase circulating stem cells.
You're probably drinking stem
I
cells in
was
that
gonna
swamp
say.
water you have.
So yeah, I mean, if I take blueberry extract and it does what? Then it just keeps my stem cells living longer, or I have more of them,
Yeah,
or-
it can help them. You know, basically, we all have circulating stem cells. So there's so many all the time. I don't remember the number, but it's in, you know, close to 1 million that can be circulated. So you can increase the number of stem cells in your circulation so that you have more available for healing through lifestyle things and through things like blueberry extract, things like that have been shown to increase the circulating stem cells.
So what's the most common treatment that you're doing on patients right now?
Well, the most common treatment is for arthritis, and so I'm using usually fat, but I have been using some allergenic, what we call allergenic products. So those products are basically, aloe means from another person, and in this case it's from a healthy baby, from the umbilical cord or from placenta, and the FDA has oversight on the labs that we use, and then we can use that. And I've been doing quite a bit of that because it's easy to do. You don't have to do a liposuction to get fat, although I do use a little fat sometimes to act as scaffolding for the cells to build on in the joint.
So is it? I mean, let's say I've got arthritis and I come see you. Is it? Are you cutting me? Are you putting a rub on? What are you doing?
No, basically, one of the things, like, you know, with what I do is that we need to get, you know, a good history, and we need to get imaging studies to find out, you know, how bad your arthritis is or what kind of arthritis you have, to see how well you might respond, you know, to stem cells. But the treatment is actually just a simple injection, mostly, just injecting the cells.
Wow.
And so we can use, sometimes I do use anesthetic. You have to be careful how much, like in the joint, like say lidocaine, or but you have to be careful how much, and usually use diluted amounts so that you don't damage the cells.
So does insurance usually cover some of these procedures for those clients, or?
No, unfortunately it doesn't. You know, that could happen in the future, but right now it still would be considered experimental by insurance companies. So at some point I expect it will be, but I'm not sure when.
Yeah.
Interesting stuff, man. How do people get in contact with you?
Well, right now I'm starting to do a clinic up in Grand Forks at Premier Aesthetics, so Lori Mersel's clinic, and so I'm her medical director of her spa, and so I want to bring in some more regenerative medicine into the practice.
Wow.
Nice. Thanks for being here.
Yeah, thank you.
All right, stick around. Much more coming up right here on today.